We're here today to talk about telehealth in older patients. A study by researchers at UC San Francisco found that more than a third of adults over 65 had potential difficulty seeing their doctors via telemedicine, primarily due to their inexperience with technology, but also sometimes a physical disability or cognitive disability. Here are some tips to help overcome some of these challenges. First of all, remember that the patient is a consumer. Let them know how telehealth is going to help them. That goes a long ways to them trying something new that they feel a little uncomfortable with. And address any concerns that they might have. We had one patient that was in a home health setting that understood the why of telehealth, that got along fine with the technology, everything was ready to go. And then a family member said, you know, you're never going to see Nurse Nancy again at the house. Well, that did not go over well. The patient really wanted the nurse to come to the house periodically. And we had to go back and tell them that, no, don't worry. Nurse Nancy is still going to come to the house and see you. This just helps if you have questions in between. And maybe if she sees something she wants to watch a little bit extra closely, that then she can do that. Well, then the patient understood and ended up having a good experience. Prep ahead. You need to train, supply, and test. Your older patient may lack access or experience with technology. Start with what they're comfortable with, but hopefully has a good sound and picture. If they're used to surfing the internet on their computer, build from there. If they are used to looking at the tablet and to do video streaming or perhaps talking to the grandkids over FaceTime or something like that, well, then you're a long ways towards getting them comfortable with telehealth. If they're used to just a flip phone, it's going to take more work. So one thing to think about is low-level sounds can be muffling. Background noises can be disruptive. The older patient might have ringing in their ears. So we find headphones a lot of times can help with these, not so much the earbuds, but the actual headphones. Train and supply step-by-step instructions, include screenshots, and use large font. Revision can be an issue, and with this population, you want to make sure things are easily to read. And then supply a get ready guide. Let them know what to expect. If they're going to have a virtual waiting room or see the nurse first, let them know that. Also, anything they should have on hand. Had one patient very frustrated because they didn't know they were going to have the insurance cards, and they were embarrassed and feeling very frustrated because they were having to dig through things. So let them know ahead anything that they may have to have. So then you test ahead. One thing we suggest is to have a comfortable place to sit, and they might be on it for a little bit waiting for the doctor. You want them comfy. You also want them wearing comfortable clothes. They may have to pull up their pants and show a swollen knee, for example. You want to make it easy for them. And then if they are using a tablet, they're not going to want to hold it up that whole time. We suggest propping the screen so the provider can see the patient and the patient can see the provider, and it's not moving, and it's a much better picture and a better experience. If possible, test ahead and at the same time of the day as their visit. Network activity and lighting can really change depending on the time of day. And then finally, make sure the patient knows what to do if there are issues, and particularly have a number ready to call so that they know they can have that backup help if something happens. Now, during the visit, we want a positive experience. A major complaint from older patients is that they don't understand their doctor. So make sure on the provider side you have a good camera and microphone. Make the visit personable. Don't rush the patient. Allow extra time for questions. Remember, there might be network latency. Chat a bit. If you usually chat with them, do that again. It helps them get over the technology and the unusualness of telehealth visits. And then summarize the visit at the end. Reschedule if the patient misses. Call and find out why they missed. Are they having technology issues, or were they just late getting to their appointment? If you don't follow up, they're going to get this unspoken message that telehealth visit wasn't important, and you want them to know it was important. So be sure and follow up with any patients that miss a visit. Most patients can have a positive telehealth visit. It just may require a little extra help and reassurance. Thank you for listening.